Just a day after an internal memo directed to all regional managers by the National Health Insurance NHIF asking them to implement a raft of changes in the scheme starting 1st of January this year leaked, health experts have come out guns blazing, criticizing the insurer, saying the changes are only meant to burden beneficiaries who already can hardly keep up with the monthly contribution.
Yeah, the other changes that they were talking about was
Dr. Timothy Olweny, a health expert, says the measures are not conducive and are only meant to lock the vulnerable out by reducing membership as opposed to increasing the numbers.
If you were to increase the amount of money that anybody has to pay, especially those who are in default, they have to be before they access services. Then they'll have to do a cost-benefit analysis and decide, do I be able to pay this amount and access service in cash from any facility that I can? Or do I pay for this and then wait 30 days to access a benefit? So first of all, we're denying people access.
He further says the changes remain a threat to the tenets of universal health coverage that seeks to ensure that every Kenyan gets access to quality and affordable health care.
This is exposing people to out-of-pocket expenditure.
NHIF says that anyone who defaults for 12 months and above will start paying afresh and will only be eligible for benefits after 90 days from the date of resumption of payment, in addition to a one-year upfront payment. Penalties that Dr. Olweny says are punitive.
If you're supposed to pay 500 shillings a month, for example, you defaulted for 3 months. For 3 months, it means you have to pay the contribution for those 3 months at 500 shillings. So that is 1,500 shillings. For the 3 months. Then you have to pay a penalty of 50% for those 3 months. So you pay another 750 shillings, it comes to 2250. Then after that, you will have to pay for your contribution for 1 year upfront, which is another 6,000 shillings. Then again, wait 30 days to be able to access your benefit. In my perception, and I think in the perception of many of the Kenyans who are members of this scheme at the moment, the new measures are very punitive.
It further says that penalties for defaulting beneficiaries will stand at 50% of the monthly contribution for each month paid late, up to 11 months, coupled with requirements to pay for 1 year in advance and a restriction of 30 days before being eligible for benefits, a move that has now angered Kenyans.
Hiyo ni kuumiza raia, especially wenye wanafanya kwa jua kali.
Hiyo pesa hatuwezi pata, na hata tunailipa na itusaidii.
Serikali watuangalie sana, wakiokota pesa na upande mwingine wazifuatilize, waone kama mwananchi anafaidika na zile pesa.
Underlying assumption is that those voluntary members who fail to pay do it by virtue of willful neglect. They are able to pay, but they choose not to pay. I don't think that is necessarily true. I think there's a difference between willingness and ability to pay.
For now, Kenyans can only hope that the government will intervene in the matter. Gloria Milimu, K24 TV.